So what is this eClinic thing that I mentioned during the intro? What's that all about?
So the eClinic has been off and on in production for years. And there was a group of us really looking at it in about 2019. So I personally have been a clinician for a long time. We won't get into years. But since 2016, I've been doing all of my practice completely virtually, completely telemental health. And I would go and present on this idea and this model of doing telemental health work. And people would say, that's terrible. You shouldn't do that. You can't do good work if you're not in the same room with your clients. And it's amazing how that landscape has changed, because as we were trying to develop this model at PAU of maybe we should start looking at some digital tools and doing some telemental health, well, along came COVID. And that hastened our need to do that pretty quickly. So we created a zero footprint clinic where we could teach and train our psychology and counseling students to not only provide what we might call Zoom-based counseling, sort of the video, typical 50-minute sessions. It's kind of funny to call it typical, but also to bring in what we call digital therapeutics, to bring in some adjunctive work, some type of innovative digital platforms to help our clients between sessions, or to help our clinicians in different ways than we had been in brick and mortar typical agency work when we were all face to face. And so now that's what we do. We teach and train our students a little bit differently than a more traditional university would.